Hey everyone, it's Dr. Pham again. So, I've got a lot of good feedback. I think there's a lot of videos that patients want me to create on a host of different topics. I don't know where to start. So I may just do it randomly and then as a good topic comes up, we can talk about that. The format, excuse me, the format probably is all going to be over at our YouTube channel. I think the ITEI is going to transfer all these videos over there. So that's kept like as a library, and then we'll have a link on our website that, if people want to catch up on these videos. So I worked out my shoulders today, so it's a little sore. Well, so I do have an interesting topic. It's funny, when the patient actually asked, if I could do one, because it's a 40 something year old gentleman who came in with it. But before I go into that, the insurance folks, I'll never run out of materials with them. It's unreal. So I saw a patient that, there are some insurance network that I'm just not in network with. And the reason is they just pay painfully low. And I'm in the business, we're not in the business of trying to make money, but, we still have to keep the lights on. There's a particular type of insurance on the marketplace called Blue Cross Blue Shield, but it's like a certain type of HMO. Obviously I don't deal with the billing folks do, so I'm not familiar with like all these products. Dad just told me where he got it, but so I called the biller. I'm like, hey, or whoever the somewhere that's in charge of all this. I asked him, hey, how come Crescent is not it's not in network with this? I mean, we're pretty much in network with everything, because even Harris County, even Harris County or the blue card, the gold card, we're actually even in network with them. So if you come in and we happen to be at a hospital that takes that, we actually can manage you over there. But so they said, this is one of the insurance product that made it hard for us to get in. So that's not even an issue. We still wanted to get in, but they made it hard to get in. And number two, they pay just so bad that, a lot of doctors don't want to be in that network. And then, so they keep the network like very narrow. So basically, you get this narrow field of who you can get. And for certain things, I think that's okay. But, sometimes patients do want to see certain doctors, for whatever that reason may be. But back to this insurance, so there's a child that had a hard time urinating, I worked him up, and, parents knew I wasn't in network, but, they went ahead and paid cash initially for the visit and all that, and worked him up. And, there's an anatomical reason why. So he requires surgery. And so we, try to get authorization and all that. Sometimes, they may make an exception if there's a good reason, i.e., if there's not a good, if there's no one that quote unquote is capable of taking care of it within 50-mile radius or whatnot. So there are certain rules that I don't fully understand, but that sometimes, for the most part can work. But anyways, we applied for it, the kid's suffering, but, unless you go through the ER, which you can if truly the child needs to be taken care of, but, he's not at that state. And once he goes to the ER, then it doesn't matter, could care less if you don't have insurance. I still take care of you if we're covering that hospital. So, but anyways, they're very good, salt of the earth people, very, very good folks, but, bright. So we got the authorization, or we try to get the authorization, yada, 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 and they deny it. And so, I had parents come back to talk to them about different options, one of them being, paying cash, which, I don't recommend because it is very expensive. Excuse me, it's got a frog in my throat today. So anyways, long story short, Dad goes, yeah, they sent us a rejection letter. And he brought the letter. And he's like, they recommended these three. Well, Dad had looked up those three to see, well, potentially maybe he just has to go to those three. Well, the insurance listed three people. Okay, so for adults, I'll do any, like if it's penile surgery or anything complicated that was congenital or trauma, then I take care of. Otherwise, the adult guys do. And by convention and training, I'm board certified in pediatric urology. So obviously in the practice, I take care of all the kids, so anyone under 18 and whatnot. Well, they sent Dad this list. They said, well, Dr. Fam's not a network, but we got these three other doctors. I look at those three doctors, and I know them because they're pediatricians that refer to me. And, when I tend to have a lot of facial expression. So when I look at the thing, I'm kind of like, huh? And Dad goes, I know what you're probably thinking. And I go, what is it? He goes, they're pediatricians, right? I said, yeah. And so I said, so whoever rejected you gave you a list of alternatives because your son needed this surgery, but they were all pediatricians. You see how ludicrous this has become? And so then, he called them and he said, these are all pediatricians. And they're like, oh, well, Dr. Pham is a pediatrician. They're like, no, pediatric urologist. If you can't even understand a different field, I don't think you should be making a decision of, well, maybe the insurance purposely want to do that, where you're in network or out network. Anyways, it just blew me away. But anyways, they're like, oh, we're so sorry, whatever. So they gave them the name of three adult urologists. And don't get me wrong, I think just like my partners, they're great. But certain things, kids are not little people, and a urologist is not a urologist. I know some people go, well, back in the day, the old guys did everything. Well, this is not back in the day. That's why we call advancement in medicine. I hate to say it, but if you did a fellowship and you kind of work on penis all day long, you're probably going to be a little bit better than someone who, yeah, does a few penis here and there. But anyways, I rant. That's debatable, but to me, not really. But anyways, so that's just my ridiculous insurance story for today. I probably should start a series on ridiculous insurance stories because I'll never run out of material. But anyways, back to today. So we had a patient that came in that, just had pain when he urinated and, negative for urinary tract infection and all that. And also he can't pull his foreskin back. He's, like I said, it's like 40 something, a young, healthy guy from the UK, but he's been over here, 10, 15 years ago. But anyways, I operated his son. His son had, congenital penis issues. I fixed that. They were happy with the work, so they asked if, actually they saw my partner because, we have adult urologists. And since he needed kind of a penis reconstruction on the outside, and we won't go into what he needs just because, there's no reason to go into too much detail. But, my partner said, kind of explained the surgery and stuff and told him, but, my partner basically said he can do it, but we have a guy that only does penis surgeries, but you probably get better outcome with him. And so, of course, the family's like, oh, absolutely. We just didn't go to Dr. Pham in the first place because we didn't know that he did adults or he operated on adults, which I do. It just depends on what it is. But anything penis, like I said, congenital, trauma, anything like that, then I do just because pediatric training is kind of weird, but we do a lot of those. And if you look around the country, a lot of programs don't have true traumatologists. They're actually pediatric urologists. But since it has to do with like a lot of reconstructing, pediatric urologists, that's what we do. We reconstruct pretty much any tube. We're actually like true plumbers. The adult guys are too, but the pediatric urologists are even more of a plumber because really surgeries that we do typically all has to do with plumbing. Cancer in pediatric urology is very rare. So anyways, so he thought it was just going to be a simple, circumcision, anchor this down, do that. So I'm asking him some more. I'm like, urinary tract infection in men, or after H1, the incidence, so before H1 with the foreskin or without the foreskin, usually urinary tract infection in boys or males are higher than women or girls. And then after H1, the incidence tends to go down, and then for women, it goes up. And the simple answer is, without going into like biofilms and all this, feel free to message me. I can talk more about that, but that's not what you guys are here for. The long, short reason why is probably has to do with shorter P channel. The way we look at urination is the simple answer is, our body's like a toilet. And you're going to see a lot of reference to plumbing when I talk about etiology, okay? But just imagine you have your two kidneys here, and then you have your ureter, which connects to your bladder here. And so blood gets filtered into the kidney makes urine. Urine is the waste, or else if we don't have that, we'll be bloated like a toad. It goes down to your bladder, sends a signal, tell your bladder, where appropriate before, if you're potty trained, tells your bladder to squeeze, P channel is open, you urinate, good stream, you empty. Any bacteria that crawls up gets flushed out. And that's kind of how, the body gets rid of, because we have bacteria all around us. But there's ways that the bacteria can get up, both anatomically and just, biofilms and bacteria characteristics and all that. But anyway, but he's relatively young to be having voiding dysfunction. So I'm talking a little bit more. We're like, well, how long have you been having this? He goes, about 10, 15 years, doc. It's been, but it's, he's a good historian. It's getting worse. And I said, huh. I said, okay. So, and he's not of this generation, similar to my age, Gen X. So, we don't tend to stick stuff up our P channel and cause trauma that way. And, I mean, maybe, but it's just more, what I've seen in the clinic anyway, it seems a little bit more prevalent nowadays where boys or men just like to stick metal, what we call sounding. There's a whole sounding community. If you guys are interested in that, you can look that up. That they stick random stuff down the P channel and then they cause trauma to it. And anyways, so I find that more prevalent after Gen X, and I'm not really sure why. But so anyways, I'm like, okay, so where were you when they first discovered all this? And he said, oh, I was in the UK, And so anyways, without going to really his story, but the gist is that he, has a very narrowed urethra somewhere, narrowed urethral P channel, and that's the tube, for those who don't know, it's the tube that connects the bladder to the tip of the penis. That's how we urinate. And so I asked him, I said, well, what kind of tests did they do in the UK? And he goes, well, they did something called urodynamics, and they graded it from 2 to 10. Well, for those who don't know, urodynamics is kind of a test that we can test for flow, function, and all this. They put a little catheter with an electrode. And there's multiple ways of doing it, but the gist is it measures pressures and all that. And, and then the wife was there, and she said, said that they graded it 2 out of 10. I don't know what that means. We don't grade urodynamics 2 out of 10. It's a bunch of curve like a EKG. You got to read the curve and you got to interpret that. And it's like a pressure curve and all this. So I don't know what 2 out of 10 means. And so I told mom if she can't give me, or, I call her mom because I operate in the son, but it's his wife. I said, just give me the record. I'm not really sure what that means. And I said, well, what do they wanted to do for you over there? She said that they wanted to cut something out and then reconnect the tubing and leave a catheter in and all this. I kind of have an idea what they're talking about, and I asked her, I said, well, why didn't they get it done? They're like, no. They're like, I guess they call it national health care or something. Anyways, they were nervous about it, which I have to do a little bit more research, which is a topic for another day. But I have a patient from Angola recently came over for a 2-stage surgery, and it's not too hard. And so I told him, I was like, why don't you guys just get it taken care of in France or UK? Because, over here, healthcare is expensive. And, you know, I'm not here to try to make a buck everywhere. I do try to give good advice. And if I think you can get, equal or better care somewhere else and save some money, I think that's important. Um, but anyways, the dad was like, no. So they literally have to make a trip, I think, from Angola and then go to Dubai so that they don't have to do the 14-day quarantine or whatnot. And then they flew over here. Well, regardless, it's like a 30-minute surgery, and it was 40 minutes, something like that. And then keep in mind, it's just the first stage. And I think they charge, almost 24,000. But they, I guess it's the only son, and they're like, no, they also have a daughter. But regardless, it didn't matter if you have 5 kids or 1 kid. You just want the best. But anyway, so I offered France, UK, and stuff before they kind of made the whole trip, and they were like, no, we rather, and I don't know how they found me. I can't remember. Was it Google or word of mouth? I'm not sure. But like I said, I told them, I would be more than happy to take care of you. But, I'm just kind of giving you options because I do think, they have good doctors somewhere else. But anyways, back to this patient. Yeah, there's something, they just don't like I don't know what they call it, the national healthcare system or something like that. But bottom line is, I got to work them up for that, kind of see what's going on. But where's the education in all this? So I asked him, I said, well, do you stick anything up to your urethra? He goes, absolutely not. And I said, okay, well, it's rare that you're born with it because that would present much earlier. But that's possible, right? I mean, anything's possible. But he said that, but they had worked him up, and it wasn't like something congenital, like, like posterior urethral valves, where what that is you're born with like scarring in the urethra. And that's why you have slow stream and stuff. And that requires like a surgical fix. But then he said, no, but his kidney function is fine. Usually with posterior urethral valve, it usually does affect the kidney. And you do present much earlier, not at 43 or 42, somewhere around there. I think he's similar to my age. He's a healthy guy, but he said other than that, he's doing great. Except the urinary streams is getting worse and worse and worse. I have an inkling of what's going on, but back to the educational part. So he asked me, maybe I should put up an education on about urinary tract infection, specifically with STDs. And now, where is all this going to link? So I asked him, I said, well, do you, so don't stick anything down there. And I was like, well, have you ever had like catheterization, like he was in the hospital and they put a Foley in and it caused trauma? He said, no, just the only time they put a little catheter in is like this tiny little catheter where they did the urodynamics test. Well, you won't. I hope not. You shouldn't be causing trauma with that as a tiny little catheter. Usually when we talk about trauma of the urethra, is like if they put the catheter in and you have a false passage, or they accidentally blew up the balloon in the urethra. Well, you get the gist. You have a tube like this, you put a balloon. The tube is not like a metal pipe, it can expand and tear. And then when it heals, it can form a scar, and that's how you get obstruction. But interestingly, now this is what a lot of people don't know. And I asked him some more. I was like, well, have you ever had like sexually transmitted disease? And then he's like, yes, now that he has. Okay. So, UTIs, probably didn't, well, first of all, he didn't have a big history of UTI. But he had a history of sexually transmitted disease. Now, all along, his doctor kept saying, well, you could have a big prostate. Well, possibly, but for his age, 40-something with a big prostate, usually it's like problem starting, stopping, now, obviously, all of these, like prostate symptoms, UTI, stricture, all of these, sexually transmitted disease, trauma, all of these are circles, and they all can intertwine in the middle, where the middle being problems with urination, okay? So all of them can kind of present with urination problem, but that's where the clinician has to decide, based on history. And that's why for me, I think history is very important. I know a lot of doctors just spend 10 minutes with the patient and, don't elicit much of a history. Oh, okay, yeah, you need this, and then just order some tests. But I think history, is important. And, he's a little young for having prostate problem. And, when my partner examined him, he said, no, his prostate wasn't all that big. At PSA was normal, all that. And I said, well, all those are possible, but just the way he's describing in his history in the past, I don't think so. I think there's probably some scarring in the urethra. So I was explaining to him about scarring. Right now, I don't have a working diagnosis. That's where we're going to kind of work him up to. We have tests to figure that out. But the interesting thing is, he did not know there was a link between sexually transmitted disease and urethral stricture and urinary issues. Okay, so and it's the same thing, specifically, the one that's well documented on it is gonorrhea. So, by having gonorrhea, it can lead to scarring in the even treated, it can lead to scarring in the urethra, which then can lead to, depending on how extensive the scarring is, can lead to extensive surgery versus as simple as a dilation. So, just like with any disease, you have spectrum. You have 1 through 10, 1 being, could be as simple as no symptoms to all the way to you need a whole long reconstruction with using graft from the mouth or, or whatnot. And I won't know this until I kind of further work him up. But yes, he never thought of, or even his wife too, they just never thought like sexually transmitted disease. Now, I'm not talking about HIV or anything like that, but certain bacteria can lead to scarring of the male urethra that requires sometimes dramatic intervention. So that's where I think, protection is important. Knowing your partner and, making sure you get treated as soon as possible, right? Because the longer you, let the gonorrhea rage, the longer it can cause problems. And so, especially in males, sexually active males, anytime you have some burning at the tip or some discharge or whatnot, you got to get treated. And at minimum, the main thing we check for is urinary tract infection, right? And I don't think you have to put down a swab anymore. They have sophisticated tests now that you can test for gonorrhea and chlamydia through urine, but that's mainly what the main things they're going to test for is gonorrhea, chlamydia, and your typical urinary tract infection bug. But the point of this topic today is just be careful about the sexually transmitted disease, because that's one thing down the road that it can cause is, and gonorrhea is a very common sexually transmitted disease, and it's usually treated with short course of antibiotics, usually a gram of ceftriaxone, and then they'll treat you with chlamydia. They have a couple different options, and then if you have a UTI, they'll treat you for that. But the topic here is stricture. So stricture being anything that can cause some scarring in the urethra that impede urinary flow. And why is that important? Well, that's important because over time, as it gets worse, it can back pressure into, and I kind of went over how urination works before. Well, the bladder may squeeze and the pee channel open, but if your pee channel itself is all scarred up, you just think of it like a traffic jam, you can cause pressure into the bladder. Well, the bladder can sustain X amount of pressure, but as the bladder just has to push hard every day, that may be due to prostate, stricture, whatever it may be, it can cause thickening of the bladder, okay? And then once you get thickening of the bladder, it becomes irreversible. So, so long, kind of, long-term symptoms without treatment can cause you to have basically issues with the bladder. And the bladder, if it can't empty, that can become a problem, right? Because then now we have to find different ways of emptying it. And that'll be a different topic for another day. Maybe that's why they made me do 8 years, just to get both of my urology training done. I never thought about how much learning I actually had to do, but now that I kind of talk about it, yeah, it's pretty extensive, I guess. I don't know if it's 8 years extensive, but probably could cut it down to like 2 or 3. But anyways, my power stick's about that big, no pun intended. I'm like that low on the totem pole, so I'm not the one who makes the decision how long you have to train. But anyways, I digress. And if the bladder causes, if you get what you call tertiary changes in the bladder and it's all scarred up and it can't empty, then next one is going to be your kidneys, right? Now, your bladder doesn't have to not work for your kidneys to be affected. Now we do worry about the bladder, but the main thing you're trying to protect is your kidneys, because then now everything's going to have a backflow, right? And you're going to backflow that pressure into the ureter and then into the kidneys. And then, the kidneys, you only have two and they don't regenerate. So too much back pressure causes what you call hydronephrosis, or kind of water in the kidneys, and it kind of pushes back on the kidney and can destroy the kidney. And then, you go down the road of dialysis and stuff. And so that can happen, okay? And and we can talk about urinary retention and that topic another day. Like I said, it's all of these fall under something called voiding dysfunction, in men's health, and not just men's health, maybe women's health too, but particularly in men because of the prostate. But like I said, prostatic enlargement, prostatic obstruction can cause issues. Urethral stricture can cause issues. And, mainly I wanted to educate people that, sexually transmitted disease can cause stricture, and, down the road. So even though you may have gotten it treated, you may not have the symptoms of purulence or whatever, but, so the whole goal is just be careful, especially in young sexually active males, who, may have multiple partners, whatnot. Wear a condom, and if you don't, and if you have like any early signs, symptoms, make sure you get it treated. Herpes, syphilis, all of those typically don't cause scarring, but your main culprit would be gonorrhea. Chlamydia is debatable, but I think the issue is chlamydia and gonorrhea typically go hand in hand, right? And when you look at these studies, 95% of studies in PubMed is not very well done or designed. So could it? Yeah, maybe. But we know gonorrhea for a fact. But regardless, they always the way it works is they get it tested, but it takes time for the test to come back. So empirically, they usually just treat you with either ceftriaxone or azithromycin empirically, and then if it comes back positive, your partner should really be treated also. Now, second cause of stricture. So really, your main three causes of stricture is three, right? So sexually transmitted disease or any sort of disease, congenital, meaning that's something you were born with. And then the third one, I would classify it as just trauma. So either car accident, pelvic fracture causing disruption of the whole urethra itself, trauma due to catheterization and all that. And trauma for some reason, and like I said, maybe the incident's the same. It's just after Generation X is the rise of internet, and so maybe it's just more pronounced that way. But it just seems to me, anyways, nowadays, younger people tend to stick stuff up the urethra that, that they shouldn't. Now, they use similar equipment to what I have or what we use in the clinic, but, we use it for clinical reasons, right? You come in, the tip is tight or whatnot. In the OR, we can't get a camera into your urethra or where you pee out of. So we have these things called sound, or sounding is the procedure, or dilation, and the sounds is the actual device, and they make all sorts of device. Just when I was learning about it, I just looked it up. I think you can buy them on Amazon or something for like, I don't know, $40. You can get them on Craigslist. And they basically come in like a set of 10 with like different sizes. Ooh, I don't know. But yeah, people just do it, and I guess it causes some sort of arousal. I'm not, to be honest with you, I kind of only know the the basics of it, meaning that the actual inserting and all that, because it has to do with urology, but I don't really go into the psychological reasons why people do it. But usually, if they do it, it has to do with some sort of sexual satisfaction and whatnot. But but yeah, basically, you can get trauma that way. They repeatedly do it. It can cause a false hole that can connect to your rectum. It can cause a disruption in your P channel. Um, my advice is just don't do it. But, a lot of people are not going to watch this video and be like, you know what, Dr. Pham says not to do that. Because if people really just all follow my advice, I'll be out of a job, right? So anyway, so I think that's the topic for today is sexually transmitted disease. And especially for males, if you see like milky discharge, burning sensation, it's always easier just to get it checked out. And a lot of times they'll go to their primary care. But if you had a history of sexually transmitted disease or whatnot, or you've been sticking stuff up to your urethra, and then you start noticing like a decreased stream, it could be stricture disease. But the first thing I would check is your hole, because in boys and men that are circumcised, probably the chance of you having obstructive voiding is most likely due to the tip. And that's what we call meatal stenosis or scarring. And for some reason, it mainly occurs in males who are circumcised. And what it is, the theory is, I think the cells on the urethra, inside the urethra, is different than on the outside, which is the glans penis. It kind of gets irritated, then it forms like a barrier. And then, and then over time it kind of closes up. That's an easy fix, assuming there's no deeper scarring. Because there are etiologies like BXO, balanitis erotica obliterans. That's kind of rare, but that occurs mainly in kind of African American and recurrent, recurrent scarring. And I consider that probably congenital in nature. We don't really know fully why it occurs, because it can be independent of urinary tract infection, sexually transmitted disease, sticking stuff up there, trauma. So, I could probably classify that as some sort of congenital. It may occur at any time. And those can be kind of tough to treat too, because you can't just excise out the scar. They do grow back. But that's a different topic for another day, But anyways, like I said, watch it. Any sort of topics anyone wants me to talk about, just message me or just put it in the comment below. I'm going to find some rhyme or reason to kind of set this up categorically. And like I said, most likely we'll put it on our YouTube channel, which is actually HTX Surgery. Originally it was meant to put some educational videos on there. I used to draw these videos and narrated it. But I think this format actually is a lot easier or the feedback's been better than kind of the drawing, I guess. It can get monotonous. But I think the IT folks are actually going to square all these over in there, and then we'll have a link on our website that patients can, if they come in for treatment and stuff, they can watch that before or whatnot. Okay, but like I said, if there's any specific topic anyone wants me to talk about, just let me know. Otherwise, I'm just going to pick random topics or topics that I find that's interesting in the clinic that day. But keep in mind, the goal is just to have all urologic topics put out there. Like I said, we're all specialists at Crescent. I mainly kind of do what I do. But anything I don't do, usually I have my partners put the presentation together and then I just present it. They don't like to be on video. Okay, all right, well, have a good Saturday.